show 4 minutes.
Thank you, Cathaoirleach, and thank you, Minister, for being in the House today. The reason why I asked you into the House was to discuss the lack of physiotherapy in Mayo and the fact that it has reached a crisis point. Patients from right through the life cycle, right across Mayo, are not getting the physiotherapy that they need. And this includes children, post-operative patients, people with disabilities, people with arthritis and elderly people. The plain fact of the matter is, if you can afford to access private physiotherapy and you have the means to travel, you can get as much treatment as you need. But if you are a medical card patient and living on a low income, it is becoming increasingly impossible for you to get physiotherapy in Mayo. The long-term damage of not being able to access physiotherapy is well documented. The physical pain experienced by many patients denied treatment is truly awful, and the mental trauma of knowing permanent damage is likely to arise from delayed treatment is not acceptable. The solution to this crisis is very simple, Minister. Appoint an adequate number of physiotherapists to meet the needs of those waiting for physiotherapy in Mayo. And the question is, why are physiotherapists from the panels not being appointed? Why are applicants to physiotherapy panels not being given the choice on their applications on which areas they would like to work in, not just being asked to define one area? So at least then people applying in the West should be able to be given a choice of counties in order of their preference to cover all counties. So I mean, if somebody is forced to say, I will work in Mayo, they can only choose Mayo. So somebody on the Mayo-Galway border then cannot have their application considered for another county, and I think this is absolute nonsense. I'm particularly concerned that when physiotherapists go on maternity leave, long-term sickness or move to another location, the replacement process seems to meet an absolute dead end. So it's not like the HSE don't know when someone is going on maternity leave or when someone is going to retire. They have several months' notice, yet they do not respond by employing a replacement. Why is this, Minister? I know that 3 members of staff have left in the last 3 weeks alone, in addition to others who have left in the past number of months. It's not a surprise that physiotherapists are leaving. The pressure they are under to provide a service without having sufficient hours is unsustainable. When they only are able to see a child who needs physiotherapy, at least weekly physiotherapy, for one session every 4 to 6 weeks, it reflects on the integrity of the whole discipline and causes huge distress to the children, parents and indeed the physiotherapists themselves. It's also having a knock-on effect in other medical disciplines. People who should be fully recovered and active are having to be admitted to acute hospitals and having to go back to their GPs. This is all taking up valuable, scarce resources. Patients from community and district hospitals are unable to be discharged because they cannot get the physiotherapy that would allow them to go home. There are beds that cannot be used. These are beds then that cannot be used as step-down beds from acute hospitals, which backs up the A&E departments and adds to the trolley crisis. In the meantime, we have dozens of fully qualified physiotherapists being forced to immigrate because they cannot find work in their own areas. I know one physiotherapist who has waited on a panel for months and months and has now been offered €5,000 to relocate to Canada to work in the Canadian Health Service. So who is accountable for this debacle, and what immediate action are you and the government going to put in place to sort this out? Minister, I'll give you an example of what's happening. In Belmullet, say, alone, up to last September, physiotherapy for the Belmullet District Hospital and the Community Nursing Unit was provided through primary care. A change was then made whereby this could no longer happen. Why did this happen? This is a crazy situation. There was already a backlog that was being dealt with by a physiotherapist who was there. But could you explain to me who in their wisdom decided that physiotherapy could be no longer provided to both of these facilities through primary care, that it had to be provided through social care? There's absolute mayhem going on in physiotherapy, in Mayo anyway, and I'm asking you those questions specifically and what can be done to sort it out. Thank you, Minister.
Okay, I want to thank Senator Rose Conway-Walsh for raising this very, very important issue, and I'm very interested in some of the points she's raised in relation to particularly the last point, because we have a strong, in theory, we have a strong emphasis for services within primary care settings being provided. But can I say as well, the programme for partnership government commits to a decisive shift within the health service towards primary care in order to deliver better care close to home in the communities right across the country. So that's the first thing. The aim of primary care policy is to provide services in local communities so that people can be maintained in their own homes and communities as long as possible. Effective delivery of primary care services will enable people to have direct access to integrated multidisciplinary teams of GPs, nurses, physiotherapists, occupational therapists and others. It has been estimated that up to 95% of people's health and social service needs can be met within a primary care setting, and primary care teams contribute greatly to enhancing community-based services in these areas. Now, in relation to the issues that you raised today, physiotherapy services form part of the services provided by many primary care teams, and in particular physiotherapists play a very key important role in chronic disease management, especially in instructing and guiding patients through safe and appropriate exercise regime. Physiotherapy services for adults and children are also delivered through specialist disability providers or early intervention and children's teams from the age of 0 up to 18. With regard to the particular issue raised by Senator Rose Conway-Walsh, I am advised that the HSE, that physiotherapists in County Mayo region, in County Mayo have in the region of 37,000 face-to-face contacts in a year, which is a significant figure. The second point, the HSE has informed me that there are staffing-related matters affecting the delivery of the physiotherapy services in County Mayo. These staffing issues relate to a number of factors in the paediatric services across the county, including maternity leave, sick leave and a recent resignation, as you mentioned yourself, I think. I am further advised that in the adult services, a physiotherapy post is now vacant in the Erris primary care area due to maternity leave. The HSE has advised that it is currently exploring the option of use of agency to deal with the Priority 1 trauma clients in the area. These are the most urgent cases requiring physiotherapy services, post-orthopaedic surgery and post-hospital discharge. I do appreciate that delays in access in physiotherapy services can be very, very difficult for those affected, and the need for additional therapy posts is highlighted in the programme for the partnership government. And I can tell you that as at the end of February 2017, there were 529.38 whole-time equivalent physiotherapists employed by the HSE in primary care, of which 59.48 whole-time equivalents were employed in the Community Health Organisation Area 2, which includes County Mayo. I would also like to take this opportunity to advise Senator Rose that the HSE has established, and this is in follow-up to your concerns, has established a service improvement group to develop a new model to improve waiting times in the physiotherapy services. That's the first thing. The terms of reference of this group, including devising and implementing short-term measures to address current waiting lists and agreeing a revised national model of physiotherapy provision that will be standardised across all community health organisations. Furthermore, this group will examine standardisation of the recruitment process, which I think is a very important thing, to include an agreed process and approach to vacancy management. So we have to address that issue as well. And finally, the work of this group is ongoing, and a report on this is expected later in the year. Thank you, Carla.
Yeah, briefly.
Thank you, Cathaoirleach, and thank you, Minister, for your reply. But it's quite obvious there is an absolute and complete disconnect between what you have said and what the reality on the ground is. It bears no resemblance to what people waiting for physiotherapy and those working inside physiotherapy are experiencing on the ground. It is very, very simple. The physiotherapists are there, fully qualified, ready, willing and able on these panels. What is stopping them from being recruited or being appointed? It really worries me in terms of the agency solution that you cited, because I couldn't actually believe it, but you've confirmed it to me. Apparently, there's private agencies being engaged from, I think it's from Galway, from outside the county, and they're being bought in. Do you know how long it takes to get from Galway to Mayo to Belmullet? It's a 6-hour round trip. Well, if that is the most economic way to deliver physiotherapy in Erris, God Almighty help us. That is not a solution at all. Minister, I want to know who's on this group and what advice this group are being given, because obviously this group are disconnected from what's happening as well. I have absolutely no confidence from the answer that you've given today. I do respect that you've been given that answer, but I think it needs an awful lot more urgent attention to solve the problems that are happening there. People are coming out of hospital with hip operations, with no physiotherapy and other very serious operations, and I don't think there's a realisation there of the damage that's been done right across the board. Thank you, Minister.
Very briefly,
Senator Rose, and just in relation to, I will definitely follow up on the issue of the point you raised on the service improvement group, which is to develop the improved waiting times in physiotherapy service, but also to deal with the issue that you talked there in relation to the management and particularly people addressing issues like management and maternity leave and sick leave and issues like that. Of course, the other issue, which is a very, very important thing, which is something I raise myself with the HSE on a regular basis, a red light does go on in my head when I hear that they're outsourcing services, and if you're saying your point, like the logistical thing about the difference between Galway and Balmullet and provide this, that is something, because I've seen that in the disability sector where we had a service that would cost 80 grand per person, and then all of a sudden there's a crisis outsourced, and all of a sudden I see the bills coming in for 100, twice the price. So there is a point there, and that's something we have to. So the message that I want to bring back to Minister Harris in relation to this and the HSE is that we have to ensure that the services are there. Also, sorry, the very important point that you mentioned earlier on as well, which is something that should be followed up there, is the issue of you mentioned the panels, and take your point on the counties, and also the adequate number of physiotherapists as well. There, those people are there on the panels, ready to roll. That's something I think I'll bring back and raise with the Minister. Thank you.
Thank you.